Hey everyone, welcome back to another exciting episode where we dive into the fascinating world of human anatomy. Today's quick dive is into the anatomical snuff box, a small but incredibly significant part of our wrist anatomy. Yes, it's a real thing, and it's pretty important too. You might be surprised by how much this little area can tell us about our overall wrist health. So let's start with the basics. Understanding the anatomical snuff box can give us insights into both normal function and potential injuries. The anatomical snuff box is a triangular depression on the lateral aspect of the wrist. It's a small area, but it plays a big role. You can easily see it when you extend your thumb. This simple movement reveals a lot about the underlying structures. It's bordered by the tendons of the abductor pollicis longus and extensor pollicis brevis on one side and the extensor pollicis longus on the other. These tendons are crucial for thumb movement. Inside this little triangle, there's a lot going on. It's like a busy intersection of important anatomical structures. The scaphoid and trapezium bones form the floor. These bones are essential for the stability and movement of the wrist. You've also got the radial artery running through it, along with the cephalic vein and the superficial branch of the radial nerve. These structures are vital for blood supply and sensation. So yeah, it's quite a hub. Now let's talk function. This area is not just a passive structure, it actively contributes to the wrist's functionality. This area is crucial for thumb movement and wrist stability. Without it, our ability to perform fine motor tasks would be significantly impaired. Imagine trying to grip something without the snuff box's support. It'd be a struggle. Everyday tasks like opening a jar or holding a pen would become challenging. But what happens when things go wrong? Injuries to this area can have a significant impact on wrist function. Injuries to the snuff box are more common than you might think. They can range from minor strains to more serious fractures. The most notorious one is the scaphoid fracture. This type of fracture can be particularly troublesome due to its location and blood supply. It usually happens when you fall on an outstretched hand. This common mechanism of injury can lead to significant pain and dysfunction. Within the first dorsal compartment, often causing pain in the snuff box area. It's a common issue among people who use their hands repetitively. It's common among people who perform repetitive hand or wrist movements. Activities like typing, gardening, or playing certain musical instruments can contribute to this condition. And how do you check for these injuries? Proper examination techniques are essential for accurate diagnosis. For the scaphoid fracture, palpate the snuff box. This simple test can provide valuable information about the presence of a fracture. Tenderness there is a red flag. If the patient experiences pain, further imaging studies may be needed. For de Quervain's, the Finkelstein test is your go-to. This test helps to identify inflammation in the tendons. Have the patient make a fist around their thumb and then ulnar deviate the wrist. This movement can help to pinpoint the source of the pain. Sharp pain is a positive sign. If the patient experiences sharp pain, it indicates a positive result for de Quervain's tenosynovitis. So to sum it up, the anatomical snuff box is small but mighty. Its role in wrist function and its importance in diagnosing injuries cannot be overstated. Its structure is crucial for hand function, and knowing how to examine it can save you from missing some significant injuries. Thanks for watching. We hope you found this deep dive into the anatomical snuff box both informative and engaging. If you found this useful, give it a thumbs up and subscribe for more quick dives into anatomy. Your support helps us create more content like this. See you in the next one. Stay curious and keep exploring the wonders of the human body.